A 22-year-old female presents with fatigue, pallor, and cravings for ice. She reports heavy menstrual bleeding since menarche. Lab shows low hemoglobin and low mean cell volume. What is possible diagnosis? This is classic iron deficiency anemia, menorrhagia along with low ferritin and low mean cell volume, but high total iron binding capacity. A 65-year-old male with a history of gastritis and partial gastrectomy 10 years ago. Presents with progressive weakness and numbness in his feet. Neurologic exam reveals loss of vibration sense. Her labs show low hemoglobin but raised mean core volume. Post-gastrectomy leads to loss of intrinsic factor production, which is needed for B12 absorption, later need for red cell maturation. B12 deficiency leads to macrocytic anemia along with neurological symptoms. A 3-year-old boy of Mediterranean descent is brought in for poor growth and fatigue. Physical exam reveals frontal bossing and hepatosplenomegaly. Labs show low hemoglobin along with target cells and basophilic stippling in peripheral smear. Elevated red blood cell count with severe microcytic anemia. Target cell is smear and clinical picture of frontal bossing clearly suggest. This is classical case of beta thalassemia. A 30-year-old female presents with fatigue and a palpable spleen. She reports her mother had her gallbladder removed at age 25. Her labs show low hemoglobin and cell volume but mean hemoglobin concentration is high. In peripheral smear rounded red blood cells were noticed but direct Coombs test was negative. What is the most appropriate next step in management? Family history of gallstones, splenomegaly, elevated MCHC and negative Coombs. This is hereditary spherocytosis. Initial management includes folic acid to support the bone marrow's increased RBC production. A 60-year-old female with rheumatoid arthritis presents with fatigue. Lab shows normocytic normochromic anemia with low iron and iron binding capacity. Chronic inflammation leads to increased levels of cytokines which decrease effective erythropoiesis. By either increasing hepcidin or by decreasing erythropoietin and half-life of red blood cells. A 45-year-old male with alcoholism presents with fatigue and mild jaundice. Labs show macrocytic anemia but B12 and folate levels are normal that rule out megaloblastic anemia. Liver function tests are deranged. What is possible diagnosis? Alcoholic liver disease creates macrocytic non-megaloblastic picture on lab test. Because of direct toxic effect on marrow and due to membrane lipid changes. A 15-year-old male presents with severe fatigue. He was well until 3 days ago when he developed fever and runny nose. Today he is pale and tachycardic. Family history reveals a brother with spleen problems. Labs show severe anemia with low reticulocytes. What is the diagnosis? Acute viral illness infects erythroid precursor and halt red blood production temporarily, resulting in aplastic crisis. This is different from hemolytic crisis where retic count is high. A 2-day-old newborn becomes jaundiced. He was born at term with no complications. Family history is significant for gallstones in the mother at age 25. Icteric but no hepatosplenomegaly on physical examination. Labs show high unconjugated bilirubin with negative Coombs test and spherocytes in blood peripheral smear. Maternal infant blood must match too. This is classical case of hereditary spherocytosis. Triad of negative Coombs test, family history of gallstones and spherocytes in blood are enough to diagnose. A 55-year-old female presents with fatigue and tingling in her hands and feet. She is a strict vegan. Labs show macrocytic megaloblastic anemia with positive anti-intrinsic factor antibodies with low B12 level and normal folate. What is the mechanism of her B12 deficiency? The presence of anti-intrinsic factor antibodies confirms pernicious anemia. This is autoimmune disease causing B12 deficiency in adults, even with dietary risk factors. A 25-year-old presents with dark urine after being treated for a urinary tract infection with sulfur drugs. He reports his father had blood problems. Labs show low hemoglobin and peripheral smear with Heinz bodies and bite cells. Where the problem lies. Glucose 6-phosphate dehydrogenase deficiency is genetic disorder triggered by oxidative stress leading to acute hemolytic anemia with dark urine, bite cells, and Heinz bodies in blood. A 68-year-old male with Myelides plastic syndrome has required multiple blood transfusions over the past 2 years. He now presents with fatigue, arthralgias, and bronze discoloration of his skin. Labs show high iron and glucose. Transfusional iron overload with no physiologic way to excrete deposits iron in tissues. This is secondary hemochromatosis. A 50-year-old male presents with fatigue and unintentional weight loss. He is a painter by profession and sometimes eats paint chips out of habit. Labs show high zinc protoporphyrin and basophilic stippling on smear. What is the diagnosis? Lead inhibits enzymes in heme synthesis, ALAD and ferrocytase, causing buildup of protoporphyrin and zinc protoporphyrin. A 28-year-old female at 32 weeks gestation presents with fatigue. Prenatal vitamins have been inconsistent. Labs show elevated homocysteine but normal, MMA. Pregnancy increases folate demands. Normal B12, normal MMA but elevated homocysteine is folate deficiency. A 7-year-old boy presents with severe pain in his hands and feet. He is crying and refusing to walk. Physical exam reveals hand-foot swelling. Labs show sickle and target cells in blood smear. What is the most likely diagnosis? Dactylitis is a classic presenting symptom of sickle cell disease in infants. Vaso-occlusion in small bones of hands or feet causes pain and swelling. A 25-year-old medical student presents with fatigue after donating blood 3 weeks ago. Labs show low iron but high binding capacity. With normocytic normochromic smear. What stage of iron deficiency is this? Low iron stores but hemoglobin, iron, TIBC normal. This is start of iron deficiency anemia. A 45-year-old female with chronic kidney disease, GFR 25 ml per minute, presents with fatigue. Labs show normal iron, B12 and folate level. What is the most likely cause of her anemia? Kidneys produce erythropoietin, but in chronic kidney disease its production drops, leading to normocytic, normochromic anemia with inappropriately low reticulocyte count. A 32-year-old female presents with fatigue, palpitations, and cold hands. She reports her fingers turn blue in the cold. Physical exam reveals livedo reticularis. Labs show positive direct Coombs test with high cold agglutinin titer. What is the most likely diagnosis? This is Raynaud's phenomenon, where IgM antibodies binds at low temperatures and fix complement. A 30-year-old female presents with fatigue and jaundice. She recently started taking high-dose ibuprofen for headaches. Labs show high LDH but low haptoglobin and negative direct Coombs test. What is most likely diagnosis? Ibuprofen can cause drug-induced immune hemolytic anemia. Drugs act as haptens, forming antibodies, activate complement, leading to hemolysis. A 25-year-old female with systemic lupus erythematosus presents with fatigue and shortness of breath. Labs show low retic count, low hemoglobin. Marrow biopsy shows hypercellular with fat necrosis. What is the most likely diagnosis? Pancytopenia with hypercellular marrow is classic picture of aplastic anemia. Reticulocyte count is low due to bone marrow failure. A 2-year-old boy presents with severe anemia. He was born in the US to parents from Southeast Asia. He has been healthy until recently. Labs show low hemoglobin, microcytic with peripheral smear with Heinz body and target cell. Electrophoresis show HBH. What is the most likely diagnosis? HBH disease is alpha thalassemia, intermediate moderate to severe hemolytic anemia. Southeast Asian descent is classic.